Thanks so much to the Partnership to Fight Infectious Disease for the opportunity to be with you today. Thanks to each of you who are staffers on the Hill. While in Congress, I had the opportunity and the privilege of working with many staff, whether it was in my own office or committee staff or leadership staff. And I know the hard work that you do, and please know that it's appreciated. My background is all healthcare. I'm a physician, orthopedic surgeon. I spent 25 plus years taking care of patients. That overlapped with about 8 years in the Georgia State Senate. I spent 12 plus years in the United States House of Representatives representing the 6th District of Georgia, and then was privileged to serve as the 23rd Secretary of Health and Human Services during the early time of the first Trump administration. And I always tried to bring an honest and scientific perspective to policy discussions when they related to healthcare. So I am thrilled to be with you today to discuss really a critically important topic pertaining to our public health, and that is the topic of vaccines. It certainly has been front of mind for the last 5+ years or so, but it's one that has a long and a storied history. So as we prepare for the incoming administration, today's discussion really seeks to serve as a resource for you, an opportunity for you to ask questions and to learn more about a public health tool that has been critical to keeping our nation healthy, improving our quality of life, and even expanding our lifespan, all of that from vaccines. Now, the history of vaccines is a fascinating history with many different stages of discovery and all through experimentation. And it begins literally over 1,000 years ago in the Far East with the first inoculation that was likely an oral inoculation. The concept and practice of inoculation took a long time, but it finally reached Constantinople, or present-day Istanbul, in the mid-1600s, spread from there to North Africa and then to Europe, and it found its way to the Massachusetts Bay Colony by way of an enslaved man named Onesimus, who had been inoculated to resist smallpox. And he told the Reverend Cotton Mather about this. And along with a local doctor, they promoted inoculation when a deadly smallpox epidemic arrived in Boston in 1721. Some of you may know that Benjamin Franklin's son had a son that died from smallpox in 1736. And following that, Franklin became a huge champion of inoculation. And General George Washington himself ordered that the American troops who were coming into the Continental Army during the Revolution had to be inoculated against smallpox. By the late 1700s, Edward Jenner, a name that some of you may know, observed that some milkmaids and others who'd been infected with cowpox, which was a more mild disease, seemed to be immune to smallpox, and he devised a series of experiments that resulted in the first vaccine, which markedly limited smallpox. And this remained the only vaccine in the world for almost 80 years, until Louis Pasteur in France was able to develop a process of weakening the deadly rabies virus through experimentation, and the first attenuated vaccine was discovered. In the 1800s, it was discovered that antibodies were a way that our body tries to fight infections, and scientists worked on safe ways to create antibodies to certain diseases and to give them to people basically as an immune patch, if you will, allowing folks to develop their own antibodies, thus creating the first antitoxin, using them for disabling infectious diseases like tetanus and diphtheria. In 1902, there were several injuries related to one such antitoxin, and the U.S. government created the FDA, the Food and Drug Administration, in the first step toward regulating medicines and therapies, all because of vaccines. In the 1920s, improvement throughout the development of toxoid vaccines resulted in much greater safety in administering these vaccines. And in the 30s, when the electron microscope was invented, scientists could, for the very first time, see viral particles, which facilitated the identification of more and more viruses as causes of disease, and that resulted in more development of vaccines, including to influenza and polio and measles. In 1954, Jonas Salk developed the first killed virus vaccine against polio. And in the 60s, Albert Sabin developed the first oral polio vaccine, something that I was given as a child. And over the following decades, we essentially ended polio in the world, with only minimal disease now in Central Asia, although this could be at risk. Attention was turned then to trying to eradicate whole diseases from the face of the earth with greater international cooperation. Smallpox became the first human virus to be eradicated, with the last case being detected in 1978. More scientific advances have continued with great promise, including recombinant vaccines, which target proteins on pathogens, thus making the administration of many vaccines that much safer. And COVID-19 saw the use of a new type of vaccine, messenger RNA, that certainly decreased the severity of the disease for many around the world. It also resulted in increasing public concern about vaccines and their safety, an issue I believe should be dealt with through absolute transparency of our public health institutions, which are so important to all of us. So vaccines have successfully protected millions of people from a host of infectious diseases that once spread unchecked. During my lifetime, diseases like polio and measles and whooping cough resulted in serious consequences, hospitalization, paralysis, lifelong disability, and even death. We still see that being the case in many areas of the world. But in the United States, we're essentially prisoners of our own success. We've eliminated polio in the US, we've effectively eliminated the spread of measles, and we've markedly limited the impact of a host of other vaccine-preventable diseases. Those health achievements are and were incredibly extraordinary, but those diseases and the pathogens that cause them still exist elsewhere in the world, and they still spread, which means that we've got to remain vigilant. Now, the success of vaccines makes it easy to forget the harm that these diseases can cause and the continuing risks from those illnesses. Understanding how the scientific and medical community accomplish those achievements can inform our decisions as we move forward. It's important to understand how bacteria and viruses cause diseases and how vaccines essentially train our bodies to fight those germs and to keep Americans and America healthy. Today, vaccine research and development is building on all of that expertise to advance potential vaccines to prevent and treat some of our most difficult health challenges, including Alzheimer's and cancers. But declining vaccine rates, fueled by rising skepticism about vaccines and the cause of vaccine-preventable diseases, threaten to not only reverse that progress, but to also slow the progress against new diseases. Now, to be clear, it's incredibly important that all of us ask our doctors questions to understand more about the health, safety, and efficacy of medicines and vaccines that are recommended for you and for your family. And I applaud you for seeking that information from medical professionals with expertise on these issues and asking the tough questions that you want and need answered. That's why I'm so very, very pleased to be welcoming the experts here today, Doctors Branche and Shane, physicians who can answer your questions and speak candidly about their experience with vaccines, their risks, and their benefits. A physician perspective is absolutely critical to understanding public health policy issues. And throughout my career, I've advocated for docs to have significant health policy input, which is why I'm so very glad that there are so many physicians who've been nominated to serve in the next administration. The healthcare challenges facing this country and the world are enormous and often unpredictable. But the healthcare opportunities that lie ahead are also incredibly extraordinary. Serving as the Secretary of Health and Human Services was an enormous honor for me, and I was and remain incredibly encouraged by the expertise and the knowledge and the dedication of the folks that I had the privilege of working with during my time there. We should welcome and be heartened by an increased and broadened attention on all of these issues, but we also want to be sure that policy decisions are driven by science and medical experts. And I believe that an honest public conversation about the importance and promise of vaccines ought to conclude with excitement and enthusiasm about the future of health, because the opportunities are truly endless. I know you'll enjoy today's discussion, and I look forward to serving as a resource for the new Congress and the new administration as they get underway. Thanks so much for your good work. Take care.